Hello, everyone. Thank you for joining today's 2023 Self-Nomination, Data Validation, and QCDR Measure Submission Form Demonstration. This webinar will provide information on the QCDR and Qualified Registry self-nomination process for the 2023 Mips performance period. This demonstration will provide a walkthrough of the QCDR and Qualified Registry self-nomination forms available on the QPP website, as well as the QCDR Measure submission form for those submitting QCDR measures. This presentation will be followed by a Q&A session where attendees will have an opportunity to ask questions via phone and via the Q&A box. And CMS subject matter experts will address as many questions as time allows. You are welcome to submit questions during the presentation or wait to submit your questions until the Q&A portion of the call. Now I will turn it over to Sue Billett at CMS to begin. Sue?
Hello, everyone. My name is Sue Billett. I'm part of the quality team here at CMS, and we in the PIMS team welcome you to today's webinar. Our purpose today is to provide you with an overview of the QCDR and Qualified Registry self-nomination requirements for the upcoming 2023 Mips self-nomination period. Next slide, please. Next slide. This slide just covers the CMS's normal disclaimer that we provide for these presentations. Our next slide will provide an overview of what will be discussed today. Next slide. First, we will provide an in-depth review of the self-nomination process, followed by a demonstration. Then we will walk through QCDR measure submission information, which will also be followed by a demonstration. To wrap up the presentation, we will provide a set of resources available for you to use, as well as hold a Q&A session. We ask that you keep your questions focused on the QCDR and Qualified Registry self-nomination process and/or QCDR measure-related items. Any other MIPS-related policy questions, etc., will be deferred. For additional MIPS program guidance or additional topics outside of what we cover in this presentation, we ask that you please refer to the Quality Payment Program Resource Library or submit these questions to the Qpp Service Center. Again, we welcome you, and I will now turn the presentation over to Anastasia of the PIMS team.
Thanks, Sue. We'll move to the next slide where we'll cover some self-nomination information for those folks intending to self-nominate for this year. Moving to the next slide. This slide details what a QCDR is. So a QCDR is defined as an intermediary that demonstrates clinical expertise in medicine and quality measurement development, that collects medical and/or clinical data on behalf of Mips eligible clinicians for the purpose of patient and disease tracking to foster improvement in the quality of care provided to patients. And of course, I should define that a QCDR is a qualified clinical data registry. We will also note that an intermediary with clinical expertise in medicine, such as clinicians being on staff at the organizations or lending their clinical expertise in the work carried out by their organization as a QCDR. Also an intermediary with standalone quality measurement development experience. And then also QCDR measures may support up to, QCDRs may support up to 30 QCDR measures. And you will note, as referenced in this slide, we do have the references to the final rule locations for any of these requirements set forth. So if you're looking for more information related to any of those, you can certainly look up those rule citations that are noted. We'll move on to the next slide. So some additional information related to the QCDRs. Intermediaries that do not have that clinical expertise in medicine or quality measurement development, like I referenced on the last slide, may want to partner with other organizations to collaborate together to ensure they have the necessary expertise or experience. When an intermediary does use an external organization for the purposes of perhaps data collection, calculation, or transmission, they may meet that definition of a QCDR as long as there is a signed written agreement specifically detailing the responsibilities of the various parties, of perhaps the clinical entity or the technical entity, and that agreement does need to be in place by September 1st of the year preceding the applicable performance period. Moving on to the next slide. The next slide will detail what the Qualified Registry is. So that is a separate intermediary type from the QCDR. A Qualified Registry is an intermediary that collects Mips data from Mips eligible clinicians and then submits it to CMS on their behalf. Clinicians typically work directly with their chosen Qualified Registry to submit that data on any of the selected measures or activities. Please keep in mind that Qualified Registries are not able to support any QCDR measures. Additionally, if an intermediary that's seeking to qualify as a Qualified Registry also uses an external organization for the purpose of data collection, calculation, or transmission, it also must have that signed written agreement in place as of September 1st of the year prior. Moving on to the next slide. Moving on to some additional requirements that must be met in order to participate as either a QCDR or a Qualified Registry. Of course, if for some reason you do become qualified, you do need to comply with all requirements set forth by the Physician Fee Schedule Final Rule. And many of those requirements are also detailed in the 2023 self-nomination fact sheets that are posted on the Quality Payment Program Resource Library. A link is available later on in the presentation. Next, they also must support quality improvement activities and promoting interoperability performance categories unless the third-party intermediary, Mips eligible clinicians, groups, virtual groups, or subgroups fall under the reweighting policies, and those policies are listed in this slide. If for some reason you do want to look into those further. Keep in mind that the support of the performance categories, measures, and activities listed on the qualified posting, which will happen later on in the year after self-nomination, must be complied with throughout the year, as well as the corresponding submission period, and that withdrawing mid-performance period or in the middle of the submission period or failing to support any of those services listed on the qualified posting for any reason is unacceptable and could result in termination of your organization as a third-party intermediary. Also, QCRs and Qualified Registries must support Mips value pathways, and that's also referenced as MVPs that are applicable to the MVP participants on whose behalf they may submit data. Moving on to the next slide. Okay. The next requirements we'll cover will include that QCRs and Qualified Registries must have at least 25 participants participating with their organization as of January 1st of the year prior. Those participants don't necessarily need to be using the Qcr Qualified Registry to submit quality data to CMS, but they must be participating with your organization for the purposes of qualified or for quality improvement. Additionally, all of our QCRs and Qualified Registries must be up by January 1st of the Mips performance period to accept and retain data and allow clinicians to begin their data collection as of January 1st of the performance period. A system that is live at the start of the Mips performance period is considered non-compliant with this requirement. Additionally, just keep in mind that for a system to be considered live, it must be capable of receiving that data from the clients you have signed up with your organization to participate for that particular performance period.
Okay, this next slide covers some information about the data submission. QCRs and Qualified Registries are required to submit data via the CMS specified secure method for data submission, such as the Quality Payment Program data format. Additional information regarding data submission methodologies can be found in the developer tools on the QPP website. Additionally, you must submit data on behalf of all payer data and not just Medicare Part B. You must also retain for the purposes of Mips all records and data for 6 years from the end of the performance period, and then also comply with any requests from CMS to review the submitted data. For auditing purposes, CMS may request any data or records for the purposes of Mips up to 6 years from the end of the performance period. Also, please keep in mind that QCRs and qualified registries must provide CMS access to review this data should a request be made to review that information. Moving on to the next slide. Okay, the first portion here is the business associate agreement. So QCRs and qualified registries must obtain and keep on file signed documentation that each holder of an NPI or National Provider Identifier whose data is being submitted to CMS from a QCR qualified registry, that QCR qualified registry does have the permission or authorization to submit that quality measure data. This agreement should also indicate what performance categories are being supported for that particular client, and that information should be on file as of when the client signs up with the QCR qualified registry or begins to submit data, as that is also where you would find the HIPAA agreements and permissions necessary for our QCRs and qualified registries to obtain any type of the clinical or quality data to submit. Please make sure that that BAA does comply with the Health Insurance Portability and Accountability Act, or HIPAA, privacy and security rules. Additionally, QCRs and qualified registries need to obtain clinician consents. Those consents should authorize the QCR qualified registry to submit data to CMS for the purposes of Mips participation. Please keep in mind that these consents should be obtained at the level in which you're submitting data. For example, if you are submitting data as an individual eligible clinician, you will want to collect consents at the individual level. That applies to groups as well. If you have group data, then you should be collecting it as a group, and a practice administrator or a person who has authorization to sign on behalf of the group can provide that consent. Moving on to the next slide. This slide starts off talking about the feedback report requirement. QCRs and qualified registries are required to provide performance category feedback on all performance categories supported for at least 4 times per year. Also, you must provide specific feedback to the clinicians, groups, virtual groups, or APM entities on how they compare to others within your registry that are supporting those same quality measures. Please note that CMS does not provide a template for the performance category feedback. That is something that you will come up on your own, as well as that we just want to make sure that that all of those different components within the feedback report requirement are being met. A real-time dashboard that provides feedback to your clients as they wish to obtain it is perfectly fine. However, please note that CMS does ask the QCRs and qualified registries to email the clinicians at least 4 times per year to remind them that that information is available, and then they can use that for the purposes of improving their data if that's applicable. Also, please note that exceptions to this requirement may occur if the qualified registry or QCDR doesn't receive data from their clinicians until the end of the performance period. That is also discussed further in the final rule if folks would like to take a look at that citation. The certification statement is something you will sign off on during self-nomination, and that certification just indicates that QCDRs and qualified registries will certify that all of the data submitted to CMS on behalf of Mips eligible clinicians, groups, virtual groups, and APM entities is true, accurate, and complete to the best of your knowledge. This certification applies to data submission based on the acceptance of data exports directly from the electronic EHR or other data sources. If you become aware of any submitted information that's not true, accurate, or complete, and you do need to submit corrected data or let CMS know that that incorrect data is there, you do need to let CMS know immediately. That way, if there's any steps that can be taken, that can be addressed early on. Moving on to the next slide. Okay, so this next slide covers information related to accessing the CMS systems. CMS does prohibit non-US citizens from accessing CMS IT systems and also requires all CMS programs data to be retained in accordance with the US federal policy, specifically National Institute of Standards and Technology Special Publication SP 800-63, which outlines the enrollment of identify proofing requirements, levels of assurance for federal IT systems access. Access to the QPP would necessitate passing a remote or in-person federal identity proofing process that is Equifax or equivalent. A non-USA based third-party intermediaries, potential lack of social security number, TIN, or US-based address, or other elements required for identity proofing and identity verification would impact the ability to pass the necessary background checks. An inability to pass an identity proofing may limit or fully deny access to the QPP if the intent is to interact with the QPP outside of the US for the purposes of reporting and storing data. There is additional information in the 2029 Physician Fee Schedule final rule related to this if folks do need to take a look at that. Moving on to the next slide, we'll talk a little bit about data validation. So during self-nomination, you will be required to submit a data validation strategy for CMS review and approval. This strategy should thoroughly explain the validation process of quality improvement activities and promoting interoperability data submitted to CMS. The QCRs and qualified registries must then conduct that data validation strategy for the 2023 Mips performance period prior to any data being submitted to CMS on behalf of any of your clients. Please keep in mind that does apply to both voluntary and opt-in folks, as well as any of the folks participating as a Mips eligible entity. Also, please note that you must use clinical documentation provided by the clinicians for whom you are submitting the data to validate that action or outcome measure actually occurred or was performed. The 2023 data validation execution report then will actually take what you did for the data validation strategy and submit to us the results of what you have for your data validation strategy. This will be required to be submitted to CMS by May 31st of 2024. Obviously, that's a little ways off, so additional information related to that will be conveyed as soon as we get closer to that point in time. Please keep in mind that just with any type of deliverable, late, incomplete, and or absent submissions of your DVER or the results required of the targeted audit constitutes non-compliance with program requirements and may result in remedial action or termination of a QCDR qualified registry. And again, once we get closer to that time frame, a data validation execution report template will be posted on the Qpp Resource Library. Moving on to the next slide. And then we do have trainings and support sessions that we host throughout the year, similar to this, that will educate as well as offer Q&A sessions to our QCRs and qualified registries that are CMS approved for that particular performance period. Please keep in mind that QCRs and qualified registries must attend and complete the training and support sessions in the form and manner and at the time specified by CMS. For additional information regarding training and support sessions, you'll need to review the 2023 QCR and Qualified Registry Support Call Flyer. Training and support session appointments will be distributed after the self-nomination period has concluded and all of our QCDRs and Qualified Registries have been CMS approved. We do have two email addresses that you'll see there, the QCR vendor support at gdit.com and registry vendor support at gdit.com. Any type of call materials, dates, the support call flyer, anything to that effect will come out from one of those mailboxes depending on what type of vendor you are self-nominating to participate as. Additionally, I do want to note that within the self-nomination, and we'll cover this in the actual demonstration portion of the meeting, but the distribution list will be completed or populated based on the contacts you put within that self-nomination. So for your 2023 QCDR or Qualified Registry distribution list, please make sure to include as many names as you want included in that distribution list for 2023. That way we do have a full comprehensive list based on what was in your self-nomination. Moving on to the next slide. And this is actually a new requirement for this particular performance period. So for calendar year 2023 Mips performance period, the QCRs and qualified registries that are approved but do not submit any data for any of the years that they had previously participated in, so 2019 up through the 2023 performance period, must submit a participation plan for CMS approval. This participation plan must include The QCR Qualified Registry's detailed plans on how to increase the participation or encourage clinicians to submit Mips data through their QCR Qualified Registry to CMS for Mips purposes. Again, to explain that just a little bit further, if you were an existing vendor, have participated from 2019 through 2023 and have not submitted data, then we would expect a participation plan submitted by your organization. And there's definitely a new field within the self-nomination that would cover that. If this is your first year of participation, of course, you wouldn't have had one of those options in the past. Now for 2024, that rule does change just a little bit, as you'll see from the second bullet on this slide. So beginning with 2024 Mips performance period, a QCDR qualified registry that was approved but did not submit any Mips data for either of the two preceding applicable self-nomination periods must submit that participation plan for CMS approval. And similar as before, that participation plan must include the detailed plans on how you intend to increase participation or encourage your clinicians to submit data to CMS. Moving on to the next slide. This slide covers our remedial action and termination policies. So we've covered quite a few requirements, and those requirements will be detailed further as folks either become CMS approved or through our other channels, perhaps like the trainings, the support sessions, any of our resources out there on the Qpp Resource Library. If requirements are not met, CMS does have the authority to impose remedial action or terminate our QCDRs and qualified registries if there is a determination that that third-party intermediary is non-compliant with one or more of the applicable approval criteria, or has submitted false certification or submitted data that's inaccurate, unusable, or otherwise compromised. If a QCR qualified registry is placed on remedial action, then they will be required to submit a corrective action plan. We also refer to that as a CAP. That corrective action plan would be used to address any deficiencies and detail any steps taken to prevent any deficiencies from reoccurring in the future. The third-party intermediary must submit that CAP by the date specified by CMS. After that, we do note that termination could definitely occur. So one of the things that could potentially lead to termination, amongst other things, is failure to comply with the remedial action process. So that may lead to termination of the third-party intermediary for the current and or subsequent performance years. Please note that prior to discontinuing any services, whether it be that you're withdrawing or whether you've been terminated, you do need to submit to CMS a transition plan, and that transition plan should detail any steps that you need to take to ensure that your Mips eligible clinicians, groups, virtual groups, and subgroups or APM entities, inclusive of volunteer and opt-in participants to an alternative third-party intermediary submitter type, or for any measures on which the data has been collected, a collection type according to CMS approved transition plan. So of course, CMS would review and approve that similar to the CAP. With that said, we'll move to the next slide, and that will actually bring us to the demo portion of today's call. I will share my screen if folks bear with me just one moment. Okay. Now, I believe you could see my screen. Folks, let me know if you cannot. I am actually on the internet browser, and I've just navigated to the qpp.cms.gov site, where I'll just quickly show to log into the self-nomination tool right here on the web page. You will just hit sign in, enter your information, and then after you've logged in appropriately to the system, we will, let me scroll this down a little bit so I can jump into my other tab. There we go. Once you've logged into your account, you will navigate to this page. So this is actually where you will see any of your information that you may have already in your account for self-nomination. I will note that there are a couple of different ways you could submit your self-nomination. There are vendors who will get simplified self-nomination forms. And with that, You will find that your self-nomination is pre-populated with information from last year. Of course, there is information that you would still have to review, sign off on, or approve. And of course, we recommend you review everything in that self-nomination to ensure that it is still accurate. So if you see self-nominations already populated here, then of course that would be your simplified form. If for some reason you are on remedial action, you would see a blank self-nomination form. So you will be required to type in all of that information on behalf of your organization. On the other hand, if you are a new intermediary that has not participated before, you would likely not see anything here unless you'd been previously related to another QCR qualified registry. So if for some reason you do log in, and there is nothing you see in this screen, but you need to locate your intermediary, please note that there is an intermediary section where you can follow the directions to identify where you can find your particular intermediary. Again, that would be for folks that have participated in past years. On the other hand, if you are a new QCR qualified registry, you would need to add a new intermediary, as you can see from the link on there towards the right side of your screen. You would click that link, enter your intermediary name, and then select QCDR or qualified registry. Please note that if you are planning to submit as both QCDR and qualified registry for self-nomination, you would need 2 separate self-nomination statements. I will close out of here as we do have a couple created just for the purposes of today's demo. As you can see, we have a demo QCDR and qualified registry that is located on this screen. So on your landing page, you would see all of the self-nominations that you are connected to, or you'd have to create yours and then yours would populate down here. You will find there's a couple options of functionality on this screen itself. For example, we'll just use this QCDR to demo. The demo QCDR entry right here, for some reason you do want to change your intermediary name, you can just click the pencil icon, and then you will retype the name or change the name as you wish for the 2023 performance period. We also have this eye icon here. This is a very important pop-up here, as we understand that at your qualified registrar QCR, you may want a lot of folks to be able to access that self-nomination. This is where you would type that information in. If for some reason one of your colleagues should also have access to update the self-nomination, this is where you would be sure to enter their information so that they can access that as well. And then of course there is a print self-nomination function as well. Moving on to the next line here, you can see both of these self-nominations are currently new as they were created for the purpose of this demo. However, if you are an existing vendor, you would see your vendor ID populated there, also referred to as the intermediary ID on the screen here. And that would just be something that was carried over from the year prior if you are an existing vendor. You'd also see your self-nomination status. As you can tell, I've got a couple options here where our draft is in progress, which is 84% complete for the top one. And you can see my demo qualified registry self-nomination is actually in draft complete. And so you'll see the green check mark icon next to that. And you'll also find that the submit for review option is available, because once you've completed your self-nomination draft, it does give you the option to submit that for review. Moving back up to the QCDR one, there is the option to edit the self-nomination. We'll touch base on that in just a moment as we venture into the actual self-nomination. And then of course, if you wish to withdraw your self-nomination, as you may not wish to participate for the 2023 performance period, then of course you would select the withdraw. You can also access the comments, which is a box that we'll touch on a little bit more once we get into the self-nomination, but you can click this link to simply add comments between the PIMS team as well as yourself. If you have any questions, comments, if we have any feedback related to that, we do a lot of that communication right within this comment section. With that being said, we'll venture into this draft self-nomination. We are using the QCDR self-nomination for the purposes of today's demo. However, the qualified registry version is very similar. There are just a few additional fields within the QCDR self-nomination that are not available within the qualified registry, as some components are not required for the qualified registry as they are for the QCDR, for the QCR. So now we have entered into our self-nomination statement. We'll start from the top and kind of work our way down. As you can see up here at the top, we do have the view or add comments that I mentioned earlier that you could access from the homepage we just navigated off of. When we click on the view or add comments, you'll see that this extra section does open up here and you have the ability to add comments. As you can see, I've added a couple of different comments, which you can edit or delete. However, I will note that we do have an option of selecting categories, as you can see here from the general and the self-nomination category. That way, if for some reason you want to go back and look for a specific comment, you can look for whichever category it may be. If you have a question specific to QCR measures, you could filter for that and identify which category you would like to search your comments from. And as you can see down here on the right lower corner, there is a menu which you can select which comments you want to take a look at. I'll go ahead and add a comment just to show folks how that works. So I did click the add comment button, and then you'll see this additional window pop up. You can select the subject of which you want to populate or add a comment for, and then you can type in your comment as needed. There's also an option to attach files in case you need something reviewed by the team, so feel free to attach as well. I'll go ahead and send that, and as you can see, it has populated on the comments section. We'll go ahead and close that comment section and move back up here. I do want to note that there is a guides and help drop-down menu. This will refer you back to the Quality Payment Program Service Centers, I'm sorry, not Service Center, Resource Library, and provide additional links to resources as well as the workflow diagram if anybody does need any of that additional information. As you can see from this pop-up available on the Resource Library, we do have a 2023 self-nomination user guide, which is very helpful. It's got a lot of screenshots and walks folks through the step-by-step directions on how to self-nominate. We also have the QCDR fact sheet posted there. If you are on the Qualified Registry self-nomination, you would of course see Qualified Registry there. And then we do have the 2023 Qcr Measure Development Handbook available out on the Resource Library as well. Moving down into the actual, actually, let's cover over here. I do want to note that as you can see here, there's all changes saved. So the system does save your edits as you go through and make those. But if for some reason you do want to stop, pause creating the self-nomination and come back to it at a later point in time, there is a save and close button, which will save your self-nomination, and then it'll return you back out to the home page. So keep in mind that all of those changes are saved as you make them, but there is a save and close button. Now moving down into the actual self-nomination information. Similar to the landing page that we already discussed, we do have these icons available, and I wanted to touch on those for just a moment. The green check mark references that that particular tab has been fully populated. The yellow button, or the yellow icon that's kind of half completed there, does reference that the information on that tab is not necessarily half done, but at least in progress. And then as you can see from the next icon here, this particular tab has not been started at all. So we'll go through each of these tabs individually and cover those. But I'll continue reviewing this left navigation pane here before we jump into the actual content. As you can see below all of the different tabs that we have available, you'll find an assignee. Once your self-nomination has been submitted to CMS for review, it will be assigned to a teammate of mine for review, and then of course communication back and forth will start at that point. There's also the status, which as this one kind of shows, there are, this is a draft in progress. So once we've completed all the tabs, you will see that this particular icon here will change to the green check mark. But of course, it just shows what kind of status your self-nomination is in at that point in time. The submit for review button right here does show that you can submit it for review. However, the system will not let you submit it for review until every field has been fully completed. Similar to the landing page, there is a withdraw button where you may withdraw your self-nomination. Now we'll move back up. We'll go to the first tab and cover all of the information related to the intermediary contact information. I will note that for every tab that we do have the red asterisks available for all of the required fields. So please make sure to populate all of the required information. We also include help information within these question mark icons. So if you need additional information, you can certainly use those help icons, as well as that the user guide is available and more information is covered within those. So as we go through, I'll just high level cover these fields. And of course, if you have questions or you need more information related to these fields, just let us know. This first one is just about kind of demographic information related to the organization. So of course, your QCDR name or qualified registry name would be what you have typed in from the previous landing screen, but you could certainly edit it here as well using the same functionality as we went over on the landing page. What we're collecting here is your organization name then. A lot of entities will have the same name for both the QCR Qualified Registry as well as the organization name. However, we do also understand that some folks will have different names. So there may be one organization name and then they may refer to their QCR Qualified Registry as something different. If it is the same as your QCR Qualified Registry name, you can just use this check mark. However, if for some reason that organization name is something different, then you can certainly type in that different name as necessary. The next field details any type of participation or partnerships or collaborations you have for your participation. We understand that some folks may have a clinical partnership or a technical partnership to meet all of the requirements set forth for Qualified Registry or QCDR. So you would type that information into this field. You would also put your tax identification number and then indicate if you are planning to self-nominate as both a QCDR and a qualified registry. This next field is similar to the one we discussed earlier, but if you do have plans to add additional colleagues of yours into your self-nomination to ensure that they have access to the self-nomination form, you would enter them in that particular field. Then we have the intermediary information, address, phone number, website for the higher level organization or QCDR, qualified registry, and then we go on to the specific contact information. We do require that all of QCRs and qualified registries have a program, a clinical, and a technical contact on file for your organization. So you will be required to do that. We do require 3 separate ones. So it will not let you use the same person for one or more of these entities. The last field on this particular tab is additional contacts. And I will note, we don't collect everything on those specific fields, as if we need to reach out, we will reach out to the main program, clinical or technical contact, depending on the topic. However, we understand that there are times when you want more than 3 individuals included on the distribution list. So this is where you would type any of those email addresses. Again, when we create our distribution list for 2023, we will use only the emails listed within these sections. So the clinical, the program, and the technical, as well as this additional contact field to create the distribution list. If your colleagues are not included on there, they will not initially be included on the distribution list. Moving on to the next tab is the intermediary details. So just some more specific information related to your QCR qualified registry. First one is your intermediary type. We do have folks that are collaboratives, health IT vendors, HIEs or RHIOs, others, regional health collaboratives, and specialty societies. You would select what best fits your organization. And if you select other, we would ask that you type in more specific information as to what type of intermediary you are. We also ask if you're a new or existing QCDR qualified registry. Please note that is for your vendor type. So if you're a new QCDR, then you would collect new regardless of how many times you've participated as a qualified registry. So this is specific to either QCDR or qualified registry. If you are an existing QCDR or qualified registry, you would then be expected to click the checkbox for all of the years you have participated in since 2014. The next one is asking if your intermediary has participated as a QCR qualified registry during the last 2 performance period and has submitted data on behalf of the clinicians groups, virtual groups, subgroups, or APM entities inclusive of voluntary or opt-in participants. And this is where, if for some reason, as detailed in the presentation, if you have not submitted data, then you would be required to submit a participation plan. If you have submitted data, then you would just click yes, and you should be good to go. If for some reason you don't meet that requirement that was detailed earlier, you would be required to enter in your self-nomination participation plan, and that would be reviewed by CMS for approval. The next section here is regarding any type of alternative names or aliases. We have all sorts of intermediaries that use various names or acronyms to refer to their organization or QCDR. And just so we make sure we can attribute any type of deliverable or a training attendance or something to that effect back to a QCR qualified registry, we ask that you put those aliases or acronyms into this field so we can track to those accordingly. Of course, if you don't have an alias, please feel free to check the box and that open text field will go away. These next couple of questions are just for the QCDR itself. So qualified registries will not see these tabs on their self-nomination. So this first section is the QCDR details. We do collect the QCDR clinical specialties, as well as that. We do ask if you're planning to submit QCDR measures. And I will note, as of right now, I do have this field as a no. So if for some reason that you aren't supporting any type of QCDR measures, you won't see anything further for QCDR measures. However, if I do change this option to a yes, you will see that the QCDR measure submission tab will show up and you'll be able to populate that during the self-nomination window. So we'll go ahead and leave that open there, as of course we'll need to populate that information. And then, do you plan to risk adjust is also another question for the QCDRs, as we do understand there are QCRs that do risk adjust their measures. If you select no, of course, you can just move on forward. But if you do plan to risk adjust, we do ask that you provide your risk adjustment methodology for CMS review. It's simple to add that information. You can either drag and drop or browse and upload a file for CMS review. As you can see, I'm going to scroll up here. If you do click yes and don't provide anything there, you will see that my tab here is still marked as in progress. If for some reason a methodology is not required, you can see that my icon over here went straight to completed because, of course, an attachment isn't necessary then. The next section here will cover information related to your QCDR and how it meets the QCDR definition. So we will require you to populate these fields below with very detailed information. Just simply saying we have clinical expertise or we have measure development experience will not suffice as substantiating that your information satisfies the requirements to be a QCDR. So please provide detailed information on any type of clinical expertise you have within your register, within your QCDR, any type of quality measurement development experience, any type of partnerships or collaborations and their activities within your QCDR. Again, we understand that there are partnerships between clinical entities and technical entities to ensure that you meet the definition. So we understand there might be multiple organizations coming together to be a QCDR, and we want that information and the relationships detailed within this section. Patient and disease tracking capability is next, and then any type of methods used to foster the quality improvement is next. We'll move on to the next tab. And this will actually be the qualified posting. Now, I referenced the qualified posting a little bit during the presentation, but a qualified posting is the list of CMS approved vendors that is posted on the Qpp Resource Library after the self-nomination period has concluded and all of the self-nominations as well as the QCR measures have been reviewed and approved upon. We take the information straight from this tab to populate the self-nomination. So please, as you're typing in this information, please make sure that what you put in here is exactly what you would want posted for public consumption. We frequently see spelling errors and not necessarily the best grammar, so I would highly recommend that everybody proofread what you put in here, as we definitely want to make sure that what we publish on behalf of your QCDR qualified registry is, of course, accurate, but also, applies to any type of grammar rules, spelling, things like that. So as of course, I didn't type anything in for this particular tab so that you could see how a not started tab looks on the icons. I'll go ahead and populate some of this information as we go through it, so that way we can complete it and get it to a completed tab as well. The first section we collect is the cost information. That should be whatever you charge your clients to participate through your QCR registry. Please note that we do ask for you to provide the level of which that cost is applied. Is it per clinician, per group, per APM, and how frequently is that? Is it something you charge per month, per year? I know we have others that charge per specific services. All of that information should be included in that cost column. And then, of course, we have the services included in that cost. So what's related to that specific cost that you're providing? What services are you providing them for those charges? The last date accepting new clients is the next section. You will want to choose a date. Of course, the Mips performance period for 2023 would be 1/1/23 through 12/31/23. And so we would expect that the last date for you to accept clients would either be within that performance period, or we know that some entities will continue to collect data through the submission period, which would then be January through March 31st of 2024. Whenever the last point in time you'll be accepting new clients, you would of course put that particular date in here. So of course, if I put, I'm just going to go ahead and select the end of the year for 2023. And then move on to the next section. You will select what type of data collection methods you use to collect your data, whether it's claims, an electronic health record, practice management system, registry, web-based tool, or other. If for some reason you are selecting other, we of course would expect a description for that other. Performance categories reported. You will note that we do have all the performance categories here that QCRs and qualified registries will report on behalf of or can report on behalf of. Which would be improvement activities, promoting interoperability and quality. Please keep in mind that you are required to report promoting interoperability, improvement activities, and quality. So quality and improvement activities are actually grayed out and you cannot deselect those. However, as we touched on in the presentation earlier, promoting interoperability does have some exceptions available. And if you meet that particular exception, then of course you can uncheck that option, and then you'll have to verify that you do meet that exception and describe any type of reasoning as to how you meet that requirement. We'll also collect the reporting frameworks supported, whether it's traditional Mips, the APM performance pathway, or the Mips value pathway. We'll also collect the reporting options you support. That could be subgroup, group, virtual groups, APM entities, and Mips eligible clinicians. I will note that for virtual groups, we will ask you to select the specialty parameters that are available for your QCDR and qualified registry. Now, as you can tell, we're still showing in progress on this particular tab. So we needed to just select additional options as we go through. If for some reason there is a field that says this is required, like the virtual group specialty parameters, you will see this field is required and the red option. I'm going to deselect that. So we have completed all of our qualified posting details. Moving on to the attestation. These are all requirements for participating as a QCR qualified registry for 2023. As you will see, there's no option to select no, as in order to be a QCR qualified registry for 2023, you do need to abide by all of these requirements. So of course, please detail all of these requirements or review them in depth to ensure you do meet all of those requirements. I'll briefly just touch on them. We do have a requirement about training and support sessions, about collecting and transmitting data through a registry, the certification statement of submitting true, accurate, and complete data. The next one is that you do have the ability to randomly request and receive data to confirm the accuracy. The 25 participant requirement as of January 1st. And then additionally, you must track the status, whether it be eligible, opt-in, or voluntary for your clients that you're participating with. And then QCDR and Qualified Registry requirements for feedback reports. Also, the kind of attestation that indicates that you'll continue to meet all of the qualification criteria in compliance with the requirements, and that your primary place of business is within the US, and that you meet the requirements that we discussed earlier as well. The next one is attesting that you'll continue to participate for the entire year and support the information that you did say you were planning to support, that you will implement your validation strategy, that you will submit data on behalf of all payers, that you will use the CMS specified secure method for data submission, and that you will provide information related to your data validation, and then that you will execute your data validation strategy and provide the results to CMS in a DVER. Of course, there's a lot more information for all of those requirements than what I just briefly went over at a very high level. So please make sure you do a complete review of that and that you meet all those requirements. And once you have completed all of those, we do ask that you indicate who's reviewed all of those and sign off on those particular attestations that were marked as a yes. Moving on to the next tab. We do have the improvement activities first here. This will be selecting what improvement activities you plan to support for the 2023 performance period. Please note that the improvement activities supported or listed on this particular tab are based on the improvement activities finalized for the 2022 physician fee schedule final rule. However, we do understand that the 23 proposed and final rule may adjust that list. After the final rule is available, you will have the ability to go back and update the improvement activities you support. So at this point in time, please select the activities you plan to support based on the 2022 list. And then of course, you can change it as I noted. We do have a link to further review the activity descriptions if you would like to do that. Otherwise, you will select that you're supporting all of them or some of them. And if you are selecting some of them, then you will see there's a drop down and you can select all of the different improvement activities you plan to support for that year. I do want to note that towards the very bottom of this list, if there is a subcategory of improvement activities you're planning to support, you can go ahead and select the entire list if you would like to, rather than having to select individual improvement activities as you go. So you could certainly use these subcategories and select which subcategories you're supporting all of the improvement activities underneath that category for. The Promoting Interoperability tab is very similar, again, done based on the 2022 physician fee schedule, and you'll have an opportunity after the 2023 physician fee schedule final rules available to update if necessary. With this tab, you do have the same options of all and some, but you also see that there is a none available. The only folks that should be selecting none would be the folks that meet that exception for the 2023 performance period. And of course, we would expect that on the intermediary details tab where we reviewed that information, I'm sorry, on the qualified posting details tab where we reviewed that information you included the information as to how you meet the exception, we would expect to be able to review that information there if you select none here. On the other hand, of course, you can select some. And then similar to the improvement activities, you may select all of the all of the promoting interoperability measures you plan to support. As with the improvement activity tab, we also have the link to view measure descriptions if you want more information on the promoting interoperability. The Mips clinical quality measures or CQMs is very similar to the last two tabs. You can see there's all, some, or none available, as well as the view measure descriptions if you need more information on the CQMs available. Again, this is created based on the 2022 rule, and you'll have an option to update in the 2023 rule once that's available. I do want to note that every QCR and qualified registry is required to support a minimum of 6 quality measures, including 1 outcome measure. If for some reason an outcome measure is not available, each intermediary must report on another high priority measure. Please note that the Mips CQMs must be used as specified. So QCRs or qualified registries are not able to tailor a CQM or alter it in any way, but must follow the specification. I will also note that the 6 quality measures can be made up of a variety or a combination of the different collection methods. So you may support the Mips CQMs, the eCQMs, or the the QCDR measures to make up those 6. However, if one particular measure is both available as perhaps a CQM and an eCQM, that would, of course, only be one measure. So as you're submitting your self-nomination, make sure you do apply those requirements as you select your measures. I will also just note all of the measures available for the 2022 final rule is also available in this dropdown if you want to select some. So some, all, or none. The eCQMs, or the electronic clinical quality measures, is the same. It does apply to the information I just provided on the CQMs. Again, the view measure descriptions is available if you want additional information. And then we have the options of all, some with the drop-down menu accordingly, and then none if you don't plan to support any eCQMs. The Mips Value Pathways, or MVPs, is a new field for this particular year, and you'll see it set up very similar to the last couple of tabs we touched on. Please note that, similar to the other ones, this information has been populated with information from the 2022 final rule, but of course could be updated in the 2023 final rule. And then of course you would have the opportunity to adjust that after the self-nomination period has concluded. So you'll find the same information here. You'll have MVP descriptions if you would like to review those. And then there is the all, some, or none options. Of course, the sum is based on the MVPs finalized within the 2022 rule. Moving on to the next tab, which is data validation. Now, all of our QCDRs and qualified registries do have a wide variety of different ways that they validate the data. We don't tell you exactly how you have to validate your data, but there are specific requirements associated to some of these different components. I would highly recommend that you take a look at the help information and or the user guide and the fact sheet to make sure that you are meeting any requirements set forth for that section. So within these fields, you will detail how you, as a QCR qualified registry, will verify the Mips eligibility of your clinicians, groups, virtual groups, subgroups, or APM entities, how you will verify the accuracy of TIN and NPI combinations, how you will verify that you are calculating reporting rates and performance rates accurately. Also, how you will describe or how you will determine or make sure you are following the 2023 versions of any measures and activities. Perhaps a measure has changed or it's a new measure. We definitely want to make sure that the correct specification is being utilized. And then we'll also ask that you detail how you plan to complete the data validation audit. This is one of those fields that does have some specific requirements that has to be met by our QCRs and qualified registries. So we do ask that you make sure that you're meeting those specific requirements. Of course, QCRs and qualified registries can go above and beyond that. We have several who do, but however you plan to complete that audit, we need the details here. And then the final component here is the targeted audit. And again, the details specific to the targeted audit would be beneficial to review to ensure that you meet the requirements set forth for that targeted audit. The next tab here is the benchmarking capabilities. This is also another field that is specific to the QCDR. So if you're a qualified registry, you would not see this tab. Benchmarking capability is required for our QCDRs. So we would expect you to click yes on this. If for some reason you click no, then of course we would have some additional questions for you, as again, this is a requirement. And we would expect that you would upload your benchmark methodology here. Again, you have the drag and drop option, or we have the browse option. I'll go ahead and just add a document here just so we can upload that. And then as you can see, that completed our benchmarking capabilities. So we've also uploaded a file. If for some reason throughout the self-nomination tool, you do have to upload some type of a document similar to this, you will see this bottom section that has just appeared saying that the self-nomination benchmarking document I just added has been uploaded. It also says who it was uploaded by. I will note that as you upload documents, we definitely request that you make sure to name it in a fashion that makes it clear as to when it was or what it is for. We understand that at times folks have to update a document or perhaps submit multiple attachments. So naming it accordingly will definitely help us identify what exactly each of the different attachments are for. So as you can tell, for this particular self-nomination, I have all of my tabs marked as completed. Of course, we do have the QCDR Measure tab available now, as I did select that we are supporting QCR measures, but we'll demo the QCR Measure portion in just a moment. A couple other things I just want to touch on from a self-nomination perspective is there are a couple of different options to navigate from tab to tab. As you can see down here at the bottom is a secondary way to navigate from tab to tab. You can either move back to the previous data validation tab from this particular tab of benchmarking capabilities we're on, or you could certainly move forward to the QCDR Measure tab. Once you have everything completed, so it would be all of these tabs completed, you would then submit the self-nomination for review. And we would expect the QCR Measure portion to be completed as well. And then once that self-nomination is submitted for review, the PIMS team will take a look at all of the information available within the self-nomination to ensure that it meets requirements. At times, sometimes we get all of the information that we need right off the bat. At other times, we have some questions to clarify or some updates that are needed. And when that occurs, the PIMS team, or whoever's assigned your particular self-nomination, will use the comment box to comment back, to ask a question, ask for clarification, or ask for updates. So I will note that as the self-nomination period moves through this cycle, we do ask that you keep an eye on your comments. If somebody adds a comment to your self-nomination, the users associated to that self-nomination will receive an email, and we do ask that you frequently either check those comments or just make sure to check your self-nomination every once in a while to ensure that you're receiving any type of update requests or clarification needs that may need to be addressed before we can finalize your self-nomination. I would also recommend that as you complete your self-nomination, submit it for review, as those statuses change, you would receive an email confirmation from the system as well. Definitely try to make sure that those emails are not being routed to your spam folder or anything to that effect, to make sure that when we do post a comment or need additional information, we can collect that as quick as possible. So as I'm sure that you're well aware, the self-nomination period will open 7/1 through 9/1. It will actually close down at 8 p.m. Eastern on September 1st. And when that lockdown does happen, the actual self-nomination form itself, all of these fields we just went through, will actually lock down, and you will no longer be able to update any of those fields. The comment box will still be available, so you can still communicate with us back and forth through the comment box. But if for some reason you have edits to make to your self-nomination in order for it to get to a state where we can approve it, we would then have to make the edits on your behalf. And when we do that, we do ask kind of a review and confirmation process of, we've made an edit on your behalf. Can you please take a look and review that information? So as you can tell, we much prefer to complete these self-nominations as quickly as possible in the process. That way, hopefully our QCDRs and qualified registries can make those edits on their own and not necessarily after the deadline when we have to make those on your behalf. With that said, that brings us to the end of the self-nomination demo portion, and the next portion we'll cover will actually dive in more to the QCDR measures, and I'll turn the call over to Stacy Sams on the PIMS team to provide some overview information on the the QCR measures, and then we'll demonstrate that information.
Thank you, Anastasia. Okay, so we're now going to transition to the QCDR measure submission process of the self-nomination, as Anastasia stated. I will be reviewing some key points and suggestions that are specific to the submission of QCDR measures, and then Marla is going to walk us through a demonstration of this process. Next slide, please. For QCDRs who will be submitting QCDR measures for CMS's consideration, you'll be utilizing the QCDR Measures tab, which is found in the Qpp self-nomination tool. Just a couple reminders for you. If you're borrowing a QCDR measure from another active QCDR, you'll need to obtain your permission to use that measure prior to submitting the measure for CMS's consideration. And this documentation will be something that you'll be instructed to upload during your measure submission process. In addition, only limited measure information will be required to be entered by the borrowing QCDR. At a later time, the PIMS team does go and insert the measure owner's final specifications for all measures that are being borrowed. In addition, previously approved QCDR measures are able to be withdrawn from consideration if you choose to not self-nominate a particular measure for the 2023 Mips performance period. And lastly, as a benefit to those QCDRs who are in good standing, you will have a pre-populated QCDR measures tab. This will consist of the 2022 performance period approved QCDR measure specifications, although there still will be a few fields that will be required for you to fill out on these pre-populated measures. These fields can vary dependent upon measure owner status, measure adoption, and whether a new or existing measure status changes. Next slide, please. This slide covers a few additional just helpful suggestions that we encourage each QCDR to take into account when you submit your measures. Before submitting, we encourage you to complete some additional internal quality assurance with the information that's being submitted. For example, fixing any errors that you may have noted through the measures information, completing spelling and grammar checks, and also verifying that any drop-down selections were used appropriately in the tool. We also ask that you please note any changes that are made to the measure regardless of the changes impact on the measure's intent. When all the changes are called out, it does really help during our measure review process. And also please just verify that all analytics are correctly applied to the measure. There's also a Qcdr Notes section that we encourage you to use for any additional information that you may feel would be pertinent to the measure review that maybe didn't fit in another place within the measure submission area of the tool. And a final suggestion, last year we had a couple instances when QCDRs were having some technical difficulties with uploading documentation within their self-nomination tool. And we ask if that if you're experiencing any issues, that you not only send us a comment within your self-nomination tool, but also send an email to the QCDR vendor support mailbox, just letting us know what problems you're experiencing. And then this will help us to ensure that you're receiving the appropriate help and that we aren't missing any deadlines at that time. Next slide, please. Just a quick recap of the QCDR measure testing requirements. New measures must have face validity at a minimum for the 2023 self-nomination, and QCDR measures approved in a preceding performance period would be required to be fully tested for the 2023 self-nomination. And lastly, for QCDR measures to be included in an MVP, they must be fully tested. Next slide, please. Due to QCDRs being the measure experts, CMS has not set specific standards for the measure testing information. For validity and reliability testing data, we do like to see the statistical results of the testing that was completed for the measure. We recommend that you submit the data and the numbers that are generated from your testing. For an example, the type of validity and reliability testing that was used and completed for the type of analysis for that measure. And it's also helpful to include testing sample sizes, statistical results, and interpretations of the testing results. We do encourage you to refer to the CMS blueprint for additional guidance on measure testing. And with that, I will now turn it over to Marla Throckmorton with the PIMS team, and she's going to walk us through a QCDR measure submission demonstration.
Thanks, Stacy. I was in the process of sharing my screen. Are you able to see the demo QCDR self-nom tool?
Yes, we can, Marla.
All right. All right. So so just for the purposes of this demo, just a reminder that if I say QCDR measure or measure, that of course I'm only referring to QCDR measures during this part of the demonstration. So Anastasia did point out that in the Intermediary Details tab, you have to answer yes. Do you plan to submit QCDR measures for the QCDR Measures tab to become present for you to be able to fill out? It's of course here under this QCDR Measure Submission subtitle. So we'll click on the QCDR Measures tab. And this is your landing page. So this is where you'll always want to go to look to see in what status your QCDR measure is in. Please note that a QCDR may only submit up to 30 measures for CMS consideration. And a second note is that this tab, so once you populate your tab, its self-nomination closes on September 1st, and then we enter the measure specification process. Then what the information in this part of the form will not be updated if there happens to be any revisions, updates, corrections to measures that occur during that measure specification process. We are not going to demonstrate the measure specification process today. We're really just going to focus on the self-nomination and or submission of the measures. So if you can see here, if a QCDR is in good standing, they will have what's called a simplified self-nomination form. And that means that all measures that were approved for 2022 Mips performance period will be populated into this status. So we'll look here. This is, of course, a demo measure. And so they will all be populated into this draft category, and you can edit the details because not every single field will be filled in with the last year's information. There are some fields that may be new or may require additional information that will not be populated for you. So we'll click here and look at edit details. So as you go through the different steps of filling in a measure, there are 4 different sections: measure info, which is numerator, denominator, etc. Analytics, is it proportional, inverse? Your testing information, and then finally the supporting documentation. And as you finalize each section, then a check mark will occur. As we see here under measure title, as the first field that has to be filled out, this red asterisk means that it is a required field. All required fields have to be filled out in order for the Submit to CMS button to be present or available for you to submit to CMS. So let's look at this. So there are some fields that are just straight text fields. And then there also are some fields that will have an option for drop-down selection. So measure title, description, denominator, numerator, etc. These are all text fields. And then you get to primary data source used for abstraction. You just click on the drop-down box, and then you can select as many as you need that apply to how you're going to collect data for this measure. So let's say we're going to use the chronic condition data warehouse. So I've clicked 3 different things, and then they'll show here is what you have selected. You can also clear these if you, you can clear one at a time if you happen to select the wrong one, or you can clear them all and start over. You can see here that this is an optional field, the Nqfid number. So that means, of course, that it's not required. And you can enter a 0, you can enter NA, you can leave it blank. It's up to you. Then there are some questions that will have an additional box that will appear if you answer a yes or a no. So for example, if we said high priority measure no, then you would just skip to the next question. But in this case, if you were to say that, yes, it's a high priority measure, then you're also asked to fill out the high priority type. And you can see the different types of high priority that CMS has set. Next, we go to the measure type and outcome, intermediate outcome, etc. The NQS domain. Again, these are only select one. And if you'll see here, it'll give you an indication if you can select more than one. In these instances, these are only select one. Care setting. You can see here, you can start typing or select, which basically means you can select more than one. So you can say all settings apply to your measure, all care settings apply to your measure, or then you can also select specific ones that you would like to show that these measures are applied to. Includes telehealth, yes or no, which meaningful measure area applies to this measure. You can select which one actually applies to your measure. And then here is a text box for you to write out your rationale for why your measure meets the meaningful measure area that you selected. Then we go to the next section, which is analytics. So you can select which type of measure calculation. You can select which measure calculation applies to your measure. Number of performance rates to be calculated or submitted and submitted. Of course, easy radio buttons that just select 1 through 10. Performance rate descriptions are optional if there's only one rate that you have selected for your measure. But if there are 2 or more, even though this doesn't change, once you have more than one performance rate, we would like for you to delineate out what rate you have for each, the description of each rate. And so, for example, you might say the first rate is females over 50, and then the quality action. Then you have males over 50 for the second rate. And then for the third rate, you might say an overall rate. Well, then you would have, so that would be the third rate. So then when you come to the next question, indicate an overall performance rate, you can select whichever performance rate that applies for this measure. And you can also select weighted average or simple average if you are calculating your measure that way. Risk adjusted status, yes or no. Is the measure able to be abstracted? Yes or no. And then this is a relatively new one. It's a disclosure to just ask if your measure requires the use of proprietary software, devices, etc., that might increase cost for the provider. Sorry about that. Next, we go to the testing section. Was the QCR measure tested at the individual clinician level? Radio button. And then you have the 3 different options. The way that I created this measure was as a new measure for 2023. In this situation, only validity testing or face validity is shown as being required. So you would enter your summary here, but if it's an existing measure, If it's an existing measure, you also need to include the feasibility and the reliability testing. If you in a moment, I'll show you how to select an existing measure. In that situation, all 3 of these should be marked as required. Then our final section is supporting documentation. You describe the link to the cost measure improvement activity. You can select, all measures are automatically selected as traditional Mips, but if you are also going to be including this measure in an MVP or a Mips value pathway, you can also select this button. Clinical recommendation statement, rationale, your performance data that's required. We recommend that you do it as number of months of data collected, the average performance rate, your range, and then the number of clinicians or groups that are included in that data. And as Stacy mentioned, if it is an existing measure with changes, we really want you to indicate what has changed to the existing measure, even if it doesn't change intent. This really aids us as we look at the review of the measure. It helps us determine, if a new measure ID is going to be required, etc. This question is similar in that, can the measure be benchmarked against the previous performance period data? Yes or no, if it's an existing measure. Obviously, if it's a new measure, it can't be benchmarked. If applicable, you can say why the previous benchmark can or cannot be used. The can is, if it can be used, that's nice to make a statement, but really what we're concerned about is cannot be used, why it cannot be used. Here's an opportunity to provide a study citation to support performance gap for the measure. If your data doesn't really support, the data that you do have available doesn't fully support a performance gap, then you can also include citations. And then you can also provide a participation plan if the QCDR has low adoption by clinicians. I did notice a question in the Q&A about how to write a participation plan. And there it is actually in the PFS final rule. It says that you can do a number of different things. One, you can do you can require that the measure be reported as a requirement of being a part of your QCDR. You can write out a adoption plan for your physicians, like an education and outreach plan. So there are 2 or 3 different things that you can also select. In our self-nomination toolkit that's made available, and it's on the Qpp Resource Library, that can be found in our information there in our fact sheets, and I think it's also included in the user guide. Here you can indicate your applicable specialty or specialties. Again, the same type of action where you can select all specialties or just select 1 or 2 that applies. And then preferred measure, published clinical category. This was just a free text field. And then finally, we had that Qcdr Notes field where you can add anything here that you feel like was not represented in any of the other fields. So as we look at this, if you did a once through, kind of just did it quickly, You can save and close it and then come back to it later if that's what you choose to do. If you don't want to go ahead and move on to the submission of the measure. You also have this option over here on the left-hand side of the screen to withdraw the measure. If you feel like, you know, we thought we wanted to submit this measure, but now we don't have, for example, the permission from the owning QCDR, and we're just going to withdraw it. That's where you would do that here. And then let's say you're ready, you've looked through it, you've double-checked it, checked for spelling and grammar, made sure all your information is correct, then you can submit to CMS. Then you'll have a brief overview. You'll have your ID, who owns the measure, what's the current status of the measure, and then of course, all of the fields that you filled out. Then you will certify and submit. Which brings us back to this dashboard. And if you notice, it was in the drafts category. Now it's been moved into the submitted category. One of the nice things that they've added this year is once it's been submitted to CMS, and if it's prior to the close of self-nomination at like 8 p.m. on September 1st, you can actually return this measure to draft. If you thought, oh no, I should have added, you know, a fourth performance rate or whatever you wanted to add, you can actually return it to draft status. And then it'll show back up in your draft category. So then you can go in, edit details, go through that whole process again and determine whether you want to, if you're ready to submit it to CMS again. Again, this is only available to you until the end of self-nomination. One thing to note is that only QCDR measures that are in this submitted status will be moved forward for review by CMS for approval for the 2023 performance period. So your goal at the end of, you know, close to the end of self-nomination is to have 0 drafts and have all your measures either in the submitted status or in this non-active, withdrawn, retired, rejected status down here in this last category. So now let's look at how do we actually add a measure. This will be the first question that you're asked. Do you own this measure? And based on your answer on whether you own or co-own or don't own the measure or borrow the measure, as we call it, this will determine which fields have to be filled out by you. Let's start with the first one, which is you're going to borrow a measure from another QCDR. This is going to ask you, has this measure been previously approved by CMS? And if you say yes, then it's going to give you the option here of finding a measure. You can click here to download the 2022 QCDR measure specifications. Of course, this includes all approved measures for 2022. And then you just simply type here the QCDR measure ID here, and then find measure. And then it will open up that same form, but it will populate as much of the information in it as possible. You can still edit every single field, but it is a way to help reduce some of the burden from as you enter a new measure. For our purposes today, we're just going to say no, it hasn't been previously approved by CMS. This situation might be the case, for example, if you're in close collaboration with another QCDR, you know that they're going to be putting forth a new measure for CMS, and you also want to be able to support this measure if CMS does approve the measure. So let's go forward with that no. And as you can see here, it's very few questions that you have to answer. You're going to enter the measure title and the measure owner. You will have to upload a documentation of approval from the other QCDR or the owning QCDR, an email, a letter, anything like that. You can drag and drop here just to prove that you do have approval from the other QCDR or the owning QCDR. You will be asked a few questions that can be different from the owner. This is going to ask, is the QCR measure able to be abstracted? And of course, we we know, or we hope, that the owner is able to abstract their measure, but just because the owner is able to does not mean that the borrower can. So this is asking you to basically attest that yes, you are going to be able on January 1 of 2023, be able to collect data and abstract all the appropriate data elements for your providers. This is the disclosure statements about the use of proprietary software. If you don't know that answer, I would just say, I would probably just reply no, and then we will go to the owner for that information. Primary data source used for abstraction, this can be different from the owner. And validity testing summary. Again, these two you may not have that information as a borrower. You can say see owner's specifications or something like that in order for us to refer back. But if you are in close collaboration and they have already sent you their proposed specs and information, please enter that information here. Again, the submission pathway, just because the owner might be participating in an MVP does not mean you have to, and that you would only be doing traditional Mips. So you can select here. If you have supported this measure in the past, for example, then you would enter any data that you have as your own QCDR that when you collected the data for that measure. You might have a different specialty than the owner, different clinical category, and then of course you have an opportunity here as well to enter any notes. We have the same options of save and close. And then once all the required fields are filled out, then this button will become available and you can submit to CMS, or again, withdraw, as you can see there. So I'm just going to save and close right now. Now we can look at, do you own this measure? Yes. Has it been previously approved by CMS? If we say yes, we'll go through that same thing of being able to pre-populate as much of the information as possible. You find the measure and then it gets you started. For the purposes of demonstration, we're going to say no. And then you start in with the measure title, etc. Because when I'm selecting no, that means it's a new measure. So that does mean that some of the things are a little bit different and you don't have an opportunity to write in like a measure ID, of course, since that measure ID has not been assigned for this new measure. Same thing, go through all the information. But as you can see, if you are an owner, you do have to fill out all of the information because the owner's measure specifications are the source of truth for the measure. We'll save and close. And finally, we'll add a QCR measure as a co-owner. Again, previously approved. If we said yes, you could find the measure. Or if we say no, new measure, we're going to go here. And it's going to ask, are you the primary steward? So when there are multiple owners, co-owners of a measure, is there one of the QCDRs that have taken the lead on the measure? Are they the ones that we can designate as the primary one that we will reach out to, of course, include all the co-owners, but then have at least one person that if we get an answer from them, then we will accept that as the way to move forward. But of course, all co-owners will be listed and will be published, when we do our measure specifications posting or a qualified posting, all co-owners are recognized and this primary steward is not as applicable, but it's during our review process. We need to know one of the co-owners that is the source of truth or that we can reach out to. And again, you go through the entire gamut of all of the fields that have to be filled out for this measure. All right, so that's the bulk of this, how to submit a QCDR measure. Remember, you want everything to be submitted by the end of self-nomination, submitted or withdrawn. You don't want any to be in this draft section. For the QCDRs that were not in good standing, really the only difference that it means for you is you can add all of your 2022 approved measures in. It's just you're going to have to go through the full manual process of adding every measure in. All right, well, good luck. We look forward to receiving your QCDR measures and working through the QCDR measure cycle. Thank you.
Hello, everyone. This is Dan. I'm going to go over a few slides with you in regards to resources that are available to you should you have any questions or need any sort of additional information. Next slide, please. All right. I don't think any of these are going to be new to anyone here, but we have the QPP website, of course, and the Mips Explore Measures and Activities tool. There's also the Qpp Resource Library. Here you'll be able to find documentation on self-nomination. The qualified postings are here, the data validation execution report template, and a lot of other valuable resources related to the program. There's also the QPP webinar library. Just a note, here is where you're going to be able to find today's slides once they've been posted. There's also the QPP help and support page. This is where you can submit questions related to the QPP program or report any issues that you may be experiencing. And of course, the QPP listserv. The sign up for this is available on the QPP website. This is a good way to stay up to date on the program, and we highly encourage you to all sign up for it if you haven't already. And next slide, please. All right, if you need any kind of assistance, you can contact the Quality Payment Program Service Center at the number and email on the screen. Email should be sent directly to qpp@cms.hhs.gov. This will automatically generate a case number for you that you can reference later should you need to. Emails should not be forwarded or CC'd to this mailbox, as it will not trigger a case number for your inquiry. And to ensure that all inquiries are routed to the appropriate subject matter experts, all inquiries should be submitted through the QPP and not the QCDR or Qualified Registry vendor support mailboxes. Next slide, please. And over to you, Anastasia.
Thanks, Dan. So we're now going to start the Q&A portion of today's webinar. So you can ask questions via the Q&A box or through the webinar audio. And just a reminder, to ask questions via the audio, please raise your hand and we will unmute your line so that you can speak. To submit a question anonymously via the Q&A box, please click Send Anonymously. I think we'll start with a few questions that we did receive through the Q&A box. The first question reads, does cost include the cost for overall registry participation, or just cost specific to Mips data submission participation?
This is Anastasia. So the cost that we would expect you to type in would be any cost that your clients would have to pay in order to participate in your registry and Mips submission. So if there's an overarching cost just to participate in your registry, they would have to pay, and an additional one for Mips submissions. We would definitely need all of that applicable information associated to any charges your clients would incur. It could be possible that it's two separate charges, but they still have to pay both of those, or one overall charge that includes all of it. Whatever it happens to be for your clients, you would have to include it in that field.
Thanks, Anastasia. And the next question we received reads, what should we put in the subgroup text field if we support all specialties? And just to read it one more time, what should we put in the subgroup text field if we support all specialties?
So the for specialties that you support, you either check the box for the applicable ones, or you can choose all specialties. And subgroups is a requirement, and there should be no text to fill out for that option.
Thank you. The next question says, what is the deadline to submit a withdrawal?
The deadline to submit your self-nomination or your withdrawal would be the same. So we would expect that you would either update and populate your self-nomination or submit a new self-nomination if you are new for 2023, or let us know that you're planning to withdraw your self-nomination for consideration for the 2023 Mips performance period by the deadline. And of course, that deadline would be 8 p.m. Eastern time on September 1st.
Great. And we did receive another question. It reads, does the Qualified Registry have to support all data collection types in MVP to support an MVP, or can they support at least one data collection type per a measure where there are more than one data collection type?
Hi, sorry, this is Colleen with the PIMS team. For MVPs, it is required that the MVP supports all of the measures found within the MVP, except for QCDRs unless you are a QCDR. But it does not require that all data collection types be supported.
Thank you. And the next question says, is there a specific template or requirement or form to follow for the participation plan?
This is Marla. I spoke to that a little bit during the demo, and I think there's some examples of what you can write into one, and it can be found in our self-nomination toolkit.
And this is Anastasia, just in case, to prevent any confusion. Of course, this year we have two different participation plans. We have the Qcr Measure participation plan, which has been a thing in the past. We also have the self-nomination participation plan. So just in case it was about that, I'll kind of tail on to the end of Marla's statement about the QCR measures. So if it is related to the self-nomination participation plan, there is no specific template. CMS will just be reviewing that information to determine how you plan to increase participation or encourage your clients to submit data on behalf of Mips.
Thank you both. Moving on to the next question, it reads, in the past, the risk adjustment was required. In other words, a yes response was required. Is that no longer the case? Also, if we are using another QCDR's measure that are risk adjusted by the other QCDR, should we answer yes and upload their risk adjustment details in plan?
So as a borrower of a QCR measure, you won't be required to answer those questions. It'll be determined by the owner. But if the owner does risk adjust, then you will also have to risk adjust. I think I missed the first part of the question. I'm sorry.
I can take it, Marla. So risk adjustment is actually part of the self-nomination portion of the tool. It'll just ask if you have any measures you plan to risk adjust. If you click no, then nothing further is required. If you click yes, then you must upload your risk adjustment methodology within that field. So yes, I assume that if you're collecting a risk adjustment strategy for those measures that you support, you would need to upload that information on that particular self-nomination tab. If for some reason you're not risk adjusting any measures, that's not required.
Thank you. And then moving on, the next question says, I'm wondering why is a no option available in MVPs? For example, not supporting MVP, if MVP is required for a qualified registry?
Yeah, so QCDRs and qualified registries they must support MVPs that are applicable to the participants on whose behalf they submit Mips data for. If the available MVPs are not applicable to their participants, then that would be the option they could choose.
Thank you. In the next question, can QCDR measures be co-owned by one entity that is a QCDR and another entity that is not a QCDR? For example, the primary steward is a QCDR, but the other co-owner is not an active QCDR.
That's fine. You can list it as being co-owned, but for the purposes of I don't know I'm sorry, I lost my words. That's fine to list an owner that is not a QCDR. The QCR does have to be the primary owner. They have to be able to make changes to the measure. They have to be able to do what is requested of them by CMS. If you want to list the co-owner, that's fine. But it won't really, if they're not a QCDR, we're not going to list them on any of our published documents.
Great, thank you.
And so to me, it's actually, I'm so sorry. To me, it's actually more appropriate to say that you are the owner of the measure. And if you want to put the co-owner in the notes so that we'll have documentation of that, that would be great.
Okay, the next question says, in a past self-nomination form, I was told I must answer yes to the question of, do you risk adjust your measures? So I've always responded with yes and supplied an explanation as to why we do not risk adjust. Just to clarify, if I answer no to the risk adjustment question, my self-nomination will still be considered, right?
Yes, that's correct. So within the self-nomination portion, if you are not risk adjusting anything, a risk adjustment methodology would not be required, and you would just select no on that particular field. And then for any type of measures you plan to risk adjust, CMS does collect the risk adjustment methodology. And I will note, since this is kind of the second time this question was asked, I think sometimes we have QCRs that get confused with the benchmarking methodology. So benchmarking is a requirement for QCDRs. So the risk adjustment is only required if you risk adjust the measures, whereas the benchmarking is required, and then the methodology. So I think a few folks get those two fields kind of mixed up, and I'm not sure that's what's happening here. But if you do not risk adjust, you do not need to submit your risk adjustment methodology.
Thank you. The next question says, are there any costs or fees associated with becoming a QR or QCDR?
No, there's no costs charged by CMS by any means to become a QCDR or qualified registry.
Perfect, thank you. The next question, how do registries prove that they can correctly calculate metrics? Example, ECQM. Do they use Cypress?
So we don't necessarily request that you prove that you calculate those metrics. We expect that as you're self-nominating and being able to attest to submit true, accurate, and complete data, that this is something your organization is able to do. Of course, CMS has the auditing policies in place. So if it for some reason looks as if incorrect data is being submitted, they could definitely subject your organization to an audit. And if inaccurate data is found, then there is always the option for penalization or something to that effect that could occur. If you had questions on how to calculate any of those measures, we would expect that a ticket be submitted to the Quality Payment Program Service Center, or the entity reach out for additional information or clarification on how to correctly calculate those measures so that accurate data is being submitted.
Thank you. The next question says, what level of detail do you want submitted for measure testing summaries? NQF level of detail or simple summary?
Yeah, so there's no direct standards, specific standards that CMS has established, but we do for validity and reliability testing. If you can provide the type of testing or the type of analysis that was completed on the measure, sample sizes that you've used, and statistical results of the testing that was completed, just to show, that it was, that it does support that the measure is valid and reliable.
Thank you. And the next question says, to clarify, if a QCDR is borrowing a measure and the borrowed measure is indeed risk adjusted, do we check yes for risk adjusted in self-nomination and upload the steward's risk adjustment plan or not?
Yes, it's one of those things that we understand that it might not be your risk adjustment methodology. However, being able to understand that you as an organization is following the correct risk adjustment methodology, that information is still collected. So within the self-nomination field, outside of the QCR measure realm, within self-nomination, we do ask you to hit yes or no. And then if yes, that you are risk adjusting measures, we would expect you to upload the methodology that you are using for those particular measures.
Great, thank you. The next question, we are looking to discontinue our qualified registry in 2023. What steps do we need to take, if any, to discontinue? Or is the measure absence of a self-nomination application for 2023 enough?
If you plan to just discontinue your QCR or qualified registry, this applies to both types. We would just expect that you not self-nominate and you withdraw your self-nomination. With that being said, if for some reason you're planning to withdraw mid-year, there are some more kind of complicated steps we have to take. So if it is as simple as just you're going to continue your 2022 participation, if you are a current QCDR qualified registry, but then just not participate for 2023, just that simple withdraw is all that needs to be done.
Perfect. I think we are out of questions and just about out of time. So I think we are going to conclude the Q&A portion of this webinar. And just as a quick reminder for everyone, the slide deck and recording from today's webinar will be posted on the QPP webinar library in the next few weeks. So thank you everyone for your time and have a great rest of your day.